This is Dr. David K. Jane, MD, a family physician serving the greater Oklahoma City area. Is it allergies? Today's question comes from Dan. I'm constantly miserable with itchy, watery eyes, sneezing, congestion, and coughing. I think I've tried every over-the-counter medication and none of them are helping. What can I do next? Well, Dan, it sure does sound like you have allergies, but infections and reactions to chemicals sometimes can give similar symptoms. The best way to establish the presence of allergies once the history suggests that they're present is to do skin testing. We perform it here in the clinic. It takes about 45 minutes. The process involves using little blocks with prongs on the end. They're dipped into wells containing liquid versions of all the common airborne allergies, including the trees, grasses, and the molds common to our region of the country, as well as dog, cat, and dust mite, a total of 48 in all. The blocks are gently rubbed into the skin. A local reaction with some redness, swelling, and itching occurs. The areas where you react, this is how we identify what you're allergic to. Once we know what you're allergic to, we can come up with a variety of treatments. Obviously, one is avoiding the offending agents. If you're allergic to dogs, then sleeping with a dog is not a good idea. And if you're allergic to elm trees, planting one in the backyard is also not a good idea. The next step in treatment is prescription antihistamines and steroid nasal sprays, which can offer some symptomatic relief. But if avoidance and symptomatic relief don't work, the next step is immunotherapy. With immunotherapy, we actually give you small amounts of the agents you're allergic to, and thereby we trick your immune system into saying, oh, that's nothing. We gradually increase the strength to the point where you're at full strength, and this desensitizes you to the offending agents. I know that the mere mention of shots causes some people to immediately eliminate this as an option, but I must stress that the needles used are the tiniest needles available, and it really is no big deal. There's minimal to no discomfort with the injections, and the immunotherapy is the only treatment we have that currently alters the course of your problem, as the antihistamines and the other medications only treat symptoms and will gradually become ineffective. With our immunotherapy, you're able to do your therapy at home with minimal visits to the office, thus saving time compared to conventional therapy where you have to go in and do an allergy shot and wait for an hour in the clinic every week. Most patients will see symptomatic improvement in a few months, and after 2 to 3 years of therapy may be symptom-free. Most insurance companies cover allergy testing and immunotherapy. If you're interested in being evaluated for symptoms you feel may be allergies, you may call us at 405-330-0038.